Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Joining us today for a quick but important discussion about the state of legal nicotine vaping in Canada is Dr. Jonathan Foulds, Professor of Public Health Sciences and Psychiatry at PennState University College of Medicine. Dr. Foulds is a trained clinical psychologist and has spent most of his career developing and evaluating methods to help smokers beat their addiction to tobacco. He was a founding member and vice president of the Association for the Treatment of Tobacco Use and Dependence and has testified to FDA on behalf of the Society for Research on Nicotine and Tobacco on regulation of nicotine replacement therapies. Dr. Foulds, thanks for joining us again on RegWatch.
Thanks for having me.
As we've been discussing on our show over the past year, it appears that Health Canada is taking a wrong turn on vaping. Dr. Foulds, from your perspective, what do you make of Health Canada's track record on vaping?
I should say that Health Canada has a good reputation for tobacco control. Canada has done a good job of reducing smoking. It's gone down in adults and it's relatively low in young people as well. And I think those Health Canada's had to deal with the increase in e-cigarette use in young people and the fears about what that could mean. So my own opinion is that overall Health Canada do a good job in tobacco control. I personally disagree on some of their recommendations for how e-cigarettes should be regulated in future. And I actually wrote to Health Canada when they asked for people to share their opinions on this. For example, they've recommended that there should be a cap on the nicotine concentration in e-cigarettes. And I think that the logic there is that by putting a cap on the concentration, somehow that would make e-cigarettes less addictive. And so the idea here was that kids would be less likely to become addicted if e-cigarettes were less addictive. But I think we know with almost certainty that's not how it works. And vapors know this too, because the nicotine that you get from an e-cigarette is not just determined by the concentration of the nicotine in the liquid. It's determined by the device and the way it works and how much heat is delivered to the coil and by the relative amounts of vegetable glycerin and propylene glycol in the e-cig, a whole bunch of factors. It's not just about the concentration of the nicotine. The reality is that in whether it's Canada, the United States, or the UK, there are more than dozens of devices you can choose. You can choose a closed pod system. You can choose a mod device that you can adjust. You can change your coils, you can adjust your wattage and all those kind of things. So it's not as if we have one kind of device and the only thing that's changing is the nicotine concentration. But in the case of Juul, they were able to compare the effectiveness of their products in helping people to quit with the same device in different countries. And in different countries, there were different concentrations available. So they were able to do a kind of natural experiment comparing Juul 2% in the United Kingdom with Juul 5% in the US. And the evidence suggests that the 2% was less effective in helping people to quit smoking. But the other part of this kind of nicotine cap regulation is that if you understand the way people use these products, and even if they use the same product, if somebody wants to get the same amount of nicotine from, let's say, a less than 2% product versus, say, a 5% product, they have to inhale more stuff, right, to get the same amount of nicotine. And we tend to believe that the nicotine that they're getting is not really the harmful part of inhaling, whether it's aerosol or smoke, it's the other stuff. And so if you have to inhale twice as much or 3 times as much aerosol to get the same amount of nicotine, which you can do, so it won't achieve its aim, but if you have to inhale twice as much stuff, meaning all the other stuff that's in the aerosol, you could potentially do harm, right? And that's the way people tend to use these products. They tend to, if you cap it at a lower level of nicotine concentration, the person using the same device would have to inhale more. And so it may actually have the opposite effect in public health as was intended.
Dr. Foulds, what about Flavours? Health Canada is still considering a nationwide ban on Flavours. Is that wise?
My opinion on Flavours is that, and my rule of thumb for the way e-cigarettes should be regulated generally relative to cigarettes, whether it's on Flavours, whether it's on nicotine delivery, whether it's on taxation, doesn't matter, is that less harmful products like e-cigarettes should never be regulated more aggressively than cigarettes, okay? If you want to encourage people to switch from a product that will kill 50% of users when used as intended to one that's much less likely to kill you or cause you diseases, then whatever you do with the harmful product, the cigarette, you must not regulate it more stringently with the less harmful product. So for me, what that means is that, fair enough, you may say we should not be selling flavors called, unicorn fart or any silly title that seems like it's going to be attractive to young people, right? And there are thousands of flavors out there, some of them with the same name as products that young people tend to like to use. I think it's reasonable for regulators to say, no, we don't need 1,000 flavors. We don't need flavors that seem to be geared to young people. We should rationalize it. What I don't believe is that the flavors should be just stuck to tobacco flavor. In the United States right now, we have menthol flavor tobacco products, cigarette products. We have them tobacco flavor. So my view is that you should actually give the less harmful product a little bit of a break. So in my mind, the way I would think of that is you should allow tobacco flavor, you should allow menthol flavor, you should allow mint flavor. Not that different, but a little bit more choice and variety than you have for your competing product that you don't want people to use, the cigarette. So here in the United States, we propose to ban menthol. So my view would be that this is an opportunity from mentholated cigarette smokers to switch to a mentholated e-cigarette product and actually have another choice to try, say, a mint flavor one. And so that's the perspective that I would like the regulators to take, that we don't want hundreds of youth attractive flavors on the market being used by young people, which is what has happened. The regulators have to respond to that. They just can't let it rip for more and more years. But that, given the evidence is so clear that e-cigarettes are less harmful than cigarettes, then we should not regulate the e-cigarettes as tightly as we're regulating cigarette products. Now, there's two ways of doing that. One is you can regulate the cigarette products more tightly. You can increase the tax on them and various things, or you can regulate the e-cigarette products in a way that gives them a slight leg up. And that's what I would suggest.
Now, you just mentioned tax. The last issue here I'd like to get your comment on with regards to Canada is that they just announced a federal excise tax that, for all intents and purposes, if combined with the provincial tax, could lead to a 100% increase in the price of certain vaping products. Is that reasonable?
Well, given what I just said, I don't think that's the right way to go. I think it's inevitable that almost all consumer products are going to be taxed. The governments are going to tax products. So I don't think it's reasonable to say, oh no taxation on e-cigarettes or any other product for that matter. I think that the taxation should be proportionate to the harms and to the things that you want to discourage versus encourage, to the danger of the thing. And so, given what I said before, whatever the taxation is per use or per pack on cigarettes, then by all means tax e-cigarette products, but don't make it anywhere close. Make it that e-cigarettes are clearly less expensive in terms of the taxation component of the price than cigarettes. That's the way I would do it.
Let me just ask, just so we've got it kind of on the record, in your professional opinion, are nicotine vaping products a viable option for smokers who are seeking to quit?
Absolutely. Absolutely. I mean, the evidence is clear on that. We just this year published a paper based on a trial, a randomized controlled trial that was actually for smokers who did not plan to quit. And they were randomized to either high, medium, or placebo nicotine e-cigarettes, or a cigarette substitute that didn't involve an electronic device at all. And it was for smokers who were interested in using a product to reduce their smoking. And we found that if they were given a device that delivered nicotine similarly to a cigarette, then it did reduce their exposure to toxicants from their cigarettes, even if they used the e-cig in conjunction with the cigarettes. So what we call dual use. But one interesting finding that was not really what we were doing the study for was that the people in that high nicotine e-cig group, as the trial went on, became more likely to quit, significantly more likely to quit. Now, the quit rates in this study were not high because it wasn't even a study designed to help people to quit smoking. But by 6 months later, the smokers who were randomized to the high nicotine e-cigarettes, about 11-12% of them had quit smoking completely. Whereas for the people not randomized to an e-cig or randomized to a placebo e-cig, it was between 0 and 3%. So that in itself, that shows that e-cigarettes that can deliver, importantly, it's not just any e-cigarette. An e-cigarette that can deliver nicotine efficiently and in the same ballpark as a cigarette. These ones gave slightly lower, but in the same ballpark as a cigarette. People who were not even planning to quit smoking were more likely to switch completely to the e-cigarettes. So that's it. That's one kind of trial. And I actually feel that the things that the people in that trial were trying to do and the e-cigarettes they were given, it made the trial actually not dissimilar to the way many people first try vaping. They're inquisitive. They're not making a big concerted quit attempt like they might use, a medication for. They've heard about them and they want to give them a try and they want to reduce their smoking and see. Sometimes want to see if it's a magic bullet and they can just switch to it, or just to see if it can help them reduce. And so I think the kind of people that were in our study and the outcomes were actually quite similar to people who try e-cigarettes in the first place. Slightly different from people who try a quitting trial or a medication trial who really want to quit smoking. So it was reassuring that we got that effect in that trial. And that can be added on to the other kinds of trials, like the one that Peter Hayek did in the UK, where it was almost like people who were coming to a smoker's clinic and they were randomized to nicotine e-cigarettes versus nicotine replacement therapy plus counselling. And in his trial in the UK, the people who were randomized to the e-cigarette, again, were about twice as likely to quit smoking a year later. So when you add those studies to other studies, and you look at, say, the Cochrane review of all the evidence, yeah, it's crystal clear that e-cigarettes can help smokers to quit.